From the KHOU 11 studios, it's Great Day Houston. And now here's your host, Deborah Duncan.
Good morning, everyone, and welcome to Great Day Houston. It is Medical Monday, where we hope to solve some of your health issues today. But we're starting off with some headlines that caught our attention this week. And the first one is actually a lot weird. The video we're about to show you may be a little graphic, so now's the time to look away if you are a little squeamish. For some, biting your fingernails is a way to cope with a little anxiety. I stopped after getting a nail caught in my throat once, okay? But this mother found several pieces of fingernail in her son's gums. Yeah, she's picking them out with tweezers right there. So how's that for oral health? Well, let's find out in today's Hot Topics. And joining us today, we have Dr. Dale Brandt, cosmetic dentist, Dr. Raza Pasha, ear, nose, and throat specialist, and Dr. Sherry Ingraham, dermatologist. Good morning. Good morning. All right, as a dentist, you've looked in many mouths and seen many things. Have you ever seen a bunch of fingernails wedged in between the gums?
No. And I had to watch each video twice. I couldn't believe it.
Yeah.
That many fingernails. I was completely blown away.
Yeah, all right. This is a man that's seen thousands of mouths. Okay, she found 27 nails in her son's gums stuck between the teeth and the permanent teeth. There she is picking them out. Oh my gosh, okay. So could that cause any problems, being wedged between the teeth and the permanent baby teeth?
It could, but most likely no. I mean, he could probably have an infection. She said in the article or the video that you know, she saw little white spots on his gums, and you know, but you could get an infection, and if you take away the source of the infection, it goes away. That's the beauty about the mouth, is it heals itself. Yeah. You get rid of the infection, the body will heal itself, and the mouth has a lot of blood flow, so you heal very, very quickly. Yeah, and kudos for her actually looking in her child's mouth, because I mean, she had to be looking good to get in there and get the nails out. I never did that. Well, my kids
you never did that. All right, I just looked at my son's mouth and found that he has a tooth up here, so I was like, wait, where'd that come from? He's like, we got to take care of that, Mom. All right, SRT treatment for skin cancer. It's a superficial radiation therapy. I'll get you to explain this more. That could work for some non-melanoma forms of cancer.
Right, this is a treatment that's been around for a while and is kind of having a resurgence, and it's more of a focal radiation treatment that you receive in office. You'd have to come in twice a week for several weeks. You know, Mohs, which is micrographic surgery, is the gold standard for skin cancer. Right. You know, the recurrence rate is about 1%. There is a very small subset of patients that say, I do not want surgery, and this may be
a scar oftentimes, right? Because what we see on the top of the skin, there's usually a lot more going on underneath the skin.
It's like the tip of an iceberg. But what, you know, we tell patients is this is not without potential side effects. You know, anytime you radiate the skin, there is a risk for later on other types of skin cancer. And so we want to use this judiciously. It's not for everyone. Perhaps in some older patients that maybe don't want to undergo surgery, they're on blood thinners, they have other medical comorbidities. But again, Mohs micrographic surgery is the ideal. This is just another option.
All right. We say melanoma. That's what we hear about all the time, but not to say there aren't other skin cancers that can be dangerous, right?
Skin cancer are the most common skin cancers in the world. Actually, basal cell is more common than any form of cancer that we currently deal with anywhere in the body.
Well, the body's largest organ,
right? But the SRT is only for basal and squamous cells, not melanoma.
Okay. All right. A new report reveals how many Americans have food allergies. Really, Dr. Pasha, you see this a lot because you deal with allergies.
Yeah, I mean, it's crazy. I mean, that EpiPen stock went way up.
Yeah, right.
So let's talk about this. I mean, it's just an epidemic, right? And it's a particular problem in first world countries and developing countries. So what's going on here? I mean, that's the question.
Food, right?
I mean, there's a lot of theories, and that's one of them. The other is that we may coddle our kids a little too much, and our kids, especially when they're young, they're supposed to eat dirt. They're supposed to engage the earth and all its nature and all its pathogens, and then
that's how you build your immune system.
That's how you build your immune system. And if you coddle your kids and they put them in a bubble or in a sterile environment, guess what? The immune system's like, well, what am I going to fight? You know, I don't have the bad stuff.
Well, that's why the first child always is sick, and like I was never sick because, like, you know, my parents didn't care by the time it got to me. Deborah's eating off the floor. Yeah, that's okay.
She'll work it out.
Yeah.
There's some truth to that, though. So now you've got this epidemic of this immune system going, okay, I don't know what to fight, so they go after things that are not supposed to be harmful, like food, and even pollen and different type of allergies. And now you have this whole slew of a generation of kids
shellfish, nut allergies, egg allergies. We've heard a lot about those over the years. But one that's kind of fairly new is we're hearing about gluten, 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 gluten. There's a friend of mine who, you know, later in life, she was having major issues with food. Her stomach was just like tearing her up. And so we have a picture of what happened when she actually ate something that had gluten in it. And you see the distended stomach on the right side. So there she was before. And she's a very thin girl, but that would happen every time she would eat something. So someone said, take gluten out. She took gluten out, and she has no more pain. Her stomach's not bloating anymore. And so she's like, look, she thought that was just a bunch of hogwash in the beginning, but she was desperate, and she tried it, and that's what happened.
You know, it's not be confused though. There's an allergy, and then there's intolerance, and there's different sensitivities. So just like gluten or people who are like lactose intolerant, that's not a true allergy that necessarily would require like an EpiPen. Like if you give her an EpiPen, it's not like the bloating will go away.
Because if an EpiPen make that stomach go down, I'd be sticking my straw. No, that's not safe. So no, don't do that. No one do that. Okay. But anyway, also the other thing too is that with allergies or the intolerances, as you mentioned, that it may be something that doesn't bother you at one age, but then later in life could bother you. So they can come and go.
Come and go. Yeah, your immune system's pretty remarkable. It adjusts, and then it can alternate as you go through your years. I've seen patients that said, hey, I never had allergies, and then they come to Houston and they develop, you know, pollen allergies and different environmental allergies, different airborne allergens. And then I've had patients the opposite, where they have, you know, incredible amount of allergies, and then their allergies go away, and that's because they have different exposures. And it's like eating honey. You know, people, you know, have honey, or just how our immunotherapy works, where they get a little bit of that pollen every day through honey. It's a natural way, and then eventually their immune system adjusts.
Yeah, and the allergies can present themselves in so many different ways, KHOU and running eyes and all that type of stuff. But then skin, skin allergies.
I often take, you know, children with eczema. One of the newest things we're discovering is that it's not actually that they're allergic to the foods initially, but because they have a broken skin barrier on their face, they're getting contact sensitization through the skin. If they had actually eaten it, they would build up a slight immunity, but because it's coming through the skin, they're mounting a different type of immune reaction, and now they're allergic to the soy or to the milk or to whatever it is. So you have to wean them off. And then a lot of patients with psoriasis and eczema will actually take them off gluten and see if they have a sensitivity and if that'll help.
There's that, and there's like there's allergies, there's stress. We see cold sores in the mouth, right?
Well, and also you can see allergies in the mouth, different types of allergies. You know, you can inflame gums. You know, what's on my tongue, doctor, et cetera, et cetera. But
what did you put on your
you just
tongue?
go through a list of different things. Have you changed, you know, toothpaste? Have you changed what you've been eating? I mean, it can pop up overnight. One day you're allergic, and over a period of time you're not, or vice versa. You're not allergic, and all of a sudden you become allergic to something.
And then sometimes there are just things that your body always didn't like, but when you get when it builds up, it's like, okay, I can't deal with you anymore. Stop drinking that. I can't deal with it anymore. Okay. Smartphone thumb. Have you heard of this? Smartphone thumb. How many of you use your smartphone? Yeah, okay. How many of you text? All right. How many of you text like one-handed with that thumb? Yeah, see there, check your thumb, because it's normally seen in factory workers, and it comes from repetitive movements of texting, and it can cause tendinitis, which I remember years ago in the newsroom I used to work in, it was all about typing, and everybody who would, you know, type on a typewriter had like tendinitis and carpal tunnel, right? And so now we got tendinitis for the thumb.
I've had it.
You've had it? Sherry, you've had it. You've had it.
I decided it was injector thumb. I wanted to make it, you know, more professional, but I actually think it was due to texting. But, you know, I think we all are so busy and we don't realize that repetitive motion throughout the day. But also we see like mouse dermatitis from people holding the mouse. There's actually been articles published that people who use their mouse all day long get a dermatitis on their hands. So I'm not surprised that there is
one of our producers is nodding her head. Have you had this, Laura? Okay, Laura's like, yes, she has had. You don't use my computer. Okay. But so anything repetitive, basically, that's not kind of in our normal range of what we do can cause issues.
We're not evolutionarily designed to text people.
Yeah.
But let me tell you, if that's the worst thing that happens, the way that that phones affect us on daily life, from texting while we're driving, being disengaged.
Absolutely.
I mean, these things are slot machines now. They really are. You're like looking at it, go, oh, I wonder what's going to come up now. Is someone going to text me? Is someone going to, you know, is some news going to come out?
There was I was on MTV Australia talking about the younger generation, about how from early on, 5 or 6, 7 or 8, when they get their phones, they get a positive feedback from their phone. And now, as young adults, they don't know how to socially interact.
Yeah.
Stimulation.
Yeah.
You'll go into a restaurant and there'll be 4 young adults there, and they all have their
And
iPhones.
on a date. It's like, okay, can you talk to each other? Put that away, right?
So when they're 65, I mean, their thumbs are going to be, they won't be able to use them.
Here's what you do. Call Bobby. Use your mouth, all right? Okay, thank you very much.